Hello everyone, welcome to Agni Nursing Academy. Today we are going to learn about the types of IV fluids and information about IV fluids. Okay, in detail we will discuss in this session. Okay, first of all we will study one general thing, that is total body fluid is of 60% of our total body weight. In that total body fluid there are two types of fluids present. First one is extracellular fluid, okay, which is of 1/3 of our total body fluid. Okay, and second one is intracellular fluid intracellular fluid, which is of 2/3 of our total body fluid. Okay, so extracellular fluid contains CSF, pleural fluid, synovial fluid. These all are extracellular fluids. For them we will also tell like transcellular fluid. In that two types of fluids are there. One is interstitial fluid, the fluid which is present in interstitial region. That fluid is known as interstitial fluid, which includes 3/4 of our total extracellular fluid. Okay. Second one is intravascular fluid, the fluid which present inside the vessels. It is called as intravascular fluid, which is of 1/4 of our total extracellular fluid. Okay. Another one is intracellular fluid. Okay. So we will discuss about this intravascular fluids, that is IV fluids. Okay. Let us see. So the fluid which is present inside the vessels is known as intravascular fluids. So what all are types of that intravascular fluids? Majorly there are two types of intravascular fluids. First one is crystalloid, another one is colloid. Okay, so one by one we will discuss in details. First one is crystalloid. Okay, that crystalloids includes water soluble electrolytes like sodium, potassium, chloride, hydrogen, calcium, etc. Okay, so here one concept we will learn, osmolarity and osmolality. So let us consider this is one solution. Everyone knows solution is made up of solute plus solvent. Okay, solution is made up of solute plus solvent. Okay, so what is osmolarity? Osmolarity is the concentration of solute, concentration of solute in solution. And what is osmolality? Concentration of solvent in solution. Okay, so the osmolarity of the solution is depends on the concentration of solute. Okay, the concentration of solute is osmolarity. Here one example we will take, that is this red color part is example as an salt, that is solute, and this blue color part is solvent, that is water. So solution is made up of solute plus solvent. So concentration of solution is depends on osmolarity, means how much amount of salt present in water decides the concentration of that solution. Okay, clear? So here we will learn what all are those types of solutions which are present. There are mainly three types of solutions present in our body. First one is isotonic solution, second one is hypotonic solution, third one is hypertonic solution. One by one we will discuss in detail. Okay, so isotonic solution is example, that is 0.9% normal saline, and one is 5% dextrose, third one is ringer lactate. Okay? These all are isotonic solutions. Second one, hypotonic solutions, means the tonicity of the solution is low, that is the solution will be diluted. Okay. In that half NS, that is 0.45% NS will come, 0.33% NS will come, 2.5% dextrose is coming hypotonic solution. Third one is hypertonic solution. Example is of 3% NS, 10% dextrose, 50% dextrose solution. These all are hypertonic solutions. So in isotonic solution, the concentration of solute is equal to the concentration of solvent. Okay, means the amount of solute is equal to the amount of solvent, that is isotonic solution. In hypotonic solution, the concentration of solute is less than the concentration of solvent, means the solution will be diluted. Okay, and third one, what is hypertonic solution? The concentration of solute is more than the concentration of solvent, that is more concentrated solution will be there. Okay, this much is done. Okay, hypertonic solution. Okay. Here we'll put one chart so that it will be easy to understand. Okay. First one here, isotonic solution. Second one is hypotonic solution, and third one is hypertonic solution. Let us consider this is one type of solution. Okay. In isotonic solution, the concentration of solute is equals to the concentration of solvent. Okay. That is concentration of solute is equal to the concentration of solvent. So that the size of cell should be an normal size. Okay. The size of cell should be a normal size. Here in hypotonic solution, the concentration of solute is less than the concentration of solvent. Means here solute is less. So the size of cell will increases. That is, cell will take the solvent inside the cell. Means cell will swell. So here in hypotonic solution, cell is going to be swell. Okay. Here normal cell size. Okay. And in hypertonic solution, the concentration of solute is more than the concentration of solvent, so that the cell will shrink. Okay. Here what happened? Cell shrink. Okay, this much is clear. So here in isotonic solution, the concentration of solute is equal to the concentration of solvent. Means the cell size will be in normal cell size. Okay, normal size only. It remains same. In hypotonic solution, the concentration of solute is less than the concentration of solvent. Means the cell will take more water inside the cell. Okay, so cell will be swell. In hypertonic solution, the concentration of solute is more than the concentration of solvent. So cell will shrink. This much is clear. So this hypertonic solution is also called as volume expander. Okay, this is an exam question. Hypertonic solution is also called as volume expander. Okay, again volume expander. Examiner will going to ask which of the following solution is also called as volume expander. So the answer will be an hypertonic solution. Okay, this much is clear. Examples we already learned here. Isotonic solution contains 0.9% normal saline ringer lactate. Here in hypotonic solution, hypotonic solution includes half NS, that is 0.45% NS, 0.33% NS, 2.5% dextrose. In hypertonic solution, example is 3% NS, 5% NS, dextrose 50%, 10% dextrose. These all are examples of isotonic, hypotonic, and hypertonic solution. Okay. One by one, we will discuss about these solutions. Okay. First of all, we'll start from isotonic solutions. So the tonicity of the solution is equal. Means solute is equal to solvent. In that we learned already example, it is 0.9% normal saline. Okay. So 0.9% normal saline having osmolarity of 308 milliosmol per liter. In that sodium includes 154 milliosmol per liter, chloride includes 154 milliosmol per liter. So 1 liter of our 0.9% normal saline includes 154 milliosmol sodium and 154 milliosmol chloride. So that total osmolarity of the normal saline is 308 milliosmol per liter. Sometimes may be asked in exam. Okay. That is osmolarity of the normal saline is how much. That is. So this 0.9% normal saline should be used in cases of increased extracellular fluid. That is intravascular fluid. Okay. So most suitable fluid with blood products. If we are giving blood means that most suitable fluid which will be given with blood products is normal saline. Okay. Next one, second example is ringer lactate. So the osmolarity of the ringer lactate is 273 milliosmol per liter. Okay. Sometimes they will ask the osmolarity of ringer lactate, osmolarity of normal saline. So these values need to be remembered. So ringer lactate is also known as Hartmann's solution. Hartmann solution. Ringer lactate is also known as Hartmann solution. Okay. Another name for ringer lactate is also known as or also considered as physiological fluid. Okay. Physiological fluid. So examiner will going to ask which solution is also called as Hartmann solution, or ringer lactate is also known as Hartmann solution. Okay. And ringer lactate is also considered as a physiological fluid. Okay. So in ringer lactate, sodium, potassium, chloride, calcium, and lactate will be there in that RL fluid. Okay. So the sodium will be 130 milliequivalent per liter. Okay. Potassium will be 4 milliequivalent per liter. Chloride will be 109 milliequivalent per liter. Calcium is 3 milliequivalent per liter, and lactate is 28 milliequivalent per liter. So in the solution of RL, total osmolarity of that ringer lactate is 273 milliosmol per liter. In that, sodium is 130 milliequivalent per liter, potassium is 4 milliequivalent per liter, chloride is 109 milliequivalent per liter, calcium is 3 milliequivalent per liter, and lactate is 28 milliequivalent per liter. So sometimes examiner will going to ask what is the concentration of or osmolarity of lactate in ringer lactate solution. So we have to give answer 28 milliequivalent per liter. Okay, that is concept of here. So here we will discuss what all are uses of our ringer lactate. So ringer lactate will be used in dehydration, okay, then sodium depletion, and ringer lactate will also be used for replacement of GIT fluid losses. Means those who are having complaints of vomiting, diarrhea, so their GIT fluids will be lost. So for that replacement of that GIT, gastrointestinal tract fluid losses, we will use ringer lactate solution. Another use of that RL is it is used in patients of burns and trauma. So in casualty, one patient came with the history of road traffic accident. Which fluid we are going to administer first? It is ringer lactate. So ringer lactate will be used in burns and trauma cases. Another use of ringer lactate is ringer lactate will be used in metabolic acidosis. Okay, these all are uses of ringer lactate. So while giving ringer lactate, what all are cautions need to be taken? So we have to avoid giving ringer lactate in these cases. Like the patient who is of liver diseases, we should avoid giving ringer lactate. Second, lactic acidosis. Already lactic acid is more in that condition. So we will avoid giving ringer lactate in this case, lactic acidosis. Another one, in cases of renal failure, we will not give ringer lactate. The patient who is having complaints of healing problems, that is healing failure. What all are those patients? The case of gangrene, the case of diabetic. So these patients are having problem in healing process. So in that process, we will not give ringer lactate solution, or we will give with caution. Okay. So liver diseases, lactic acidosis, renal failure, and healing failure patients. In these cases, we will give ringer lactate in caution. Okay. These all cautions need to be. Third one is dextrose 5% in water, D5 in water. So the osmolarity of this D5 is 252 milliosmol per liter. In that dextrose 5%, 50 gram per liter glucose is there. Okay, 50 gram per liter glucose will be there in dextrose 5% solution. So the uses of D5, okay, we will give in hypernatremic cases. So dextrose 5% should be used in treatment of hypernatremia. Okay. And in another cases, the patient who is having hypoglycemia, for that patient we will give D5. Okay. So contraindications for that D5, we will not use this fluid for fluid resuscitation because the risk of hyperglycemia will be there. So for fluid resuscitation, we will not use D5. Okay. And in cases of increased intracranial pressure, we will not give dextrose 5% solution in that case. Okay. In this increased intracranial pressure, already pressure is increased. If we are giving dextrose 5% solution, means pressure again it will be an increase. Okay, so we will avoid giving dextrose 5% solution in increased intracranial pressure condition. Okay. Second type of solution is hypotonic solution. First one is isotonic solution. We learned in that normal saline 0.9% solution. Second one is ringer lactate. We learned. Third one is 5% dextrose. We learned. Now next category is hypotonic solution. In that the tonicity of the solution will be low. So hypotonic solution we already told, we also known as diluted solution. Okay. In that the concentration of solute is less than the concentration of solvent. These things we already learned. Okay. So first one is half NS, that is 0.45% normal saline. In that osmolarity of that solution is 154 milliosmol per liter. In that 0.9% NS, the osmolarity is 308 milliosmol per liter. So half of that 0.9% NS, so half NS having osmolarity is of 154. Okay. So where we will use this hypotonic solution, that is half NS, in which condition we will going to use? First one, we will going to be used in hypovolemic cases with hyponatremia. So we have to provide sodium for that patient. So in cases of hyponatremia and hypovolemia, we will prefer half NS, that is 0.45% normal saline. So precautions should be taken. It may lead to hyponatremia due to sodium dilution. That is, solution is already diluted. So it may lead to sodium dilution. So this is the one of the risk after giving this fluid. So we need to carefully monitor for a patient for hyponatremia. Okay, this is the only caution. Okay, second one is 0.33% normal saline. Okay, second one is 0.33% normal saline or 1/3 of normal saline. That is, previous one is half normal saline. This one is 1/3 normal saline. So this is then 5% dextrose in 0.33% normal saline is of example of hypotonic solution. Okay. Third one is 0.20 225% normal saline. Okay. So this one is 1/4 of normal saline. 1/4 of normal saline. Okay. So this 0.225% normal saline is used with 5% dextrose in 0.225% normal saline. So most commonly, preferably in pediatric patient. So this 0.225% normal saline is most commonly used in pediatric patient. So this one again an exam question. Okay. Fourth type of hypotonic solution is 2.5% dextrose in water. Okay. So this 2.5% dextrose in water should be used in cases of hyponatremia and hypokalemia. So the cases of hyponatremia and hypokalemia, we will give this 2.5% dextrose solution in water. Okay. So one precaution should be taken with this fluid is it should not be given with the blood products. Okay. Again, it will be an exam question. Examiner will going to ask which hypotonic solution should not be used or should not be given with the blood products. The answer is 2.5% dextrose solution. Okay. Now, third category is hypertonic solution. So, the tonicity of the solution is more. That is, the solution will be more concentrated. Okay. This is a concentrated solution. In that, the concentration of solute is more than the concentration of solvent. That's why it is a hypertonic solution. So these hypertonic solutions, while we are giving, So we have to take one precautions. We should not give these hypertonic solutions in peripheral IV lines. Always we have to give these solutions in central venous line or PICC line. Okay. So this one we have to take precautions while giving this hypertonic solution, not given in peripheral IV lines. Always we have to administer through CVP line or PICC line. Okay. What all are those solutions which are considered to be an hypertonic? First one is 3% normal saline or 5% normal saline. These are hypertonic solutions. These solutions should be used in cerebral edema patients. Okay. The patient should have an cerebral edema. For that patient, we will administer 3% normal saline or 5% normal saline. Why? Because the patient having already edema of that cerebral cells. Okay. So we already learned that in after giving administering hypertonic solution, the cell will be an shrink. Okay. So after giving this solution, this edema will resolve. Okay. Edema will resolve and cell will come in normal size. Okay. So the size of cell will decrease. So in cases of cerebral edema, we will give 3% normal saline or 5% normal saline. Okay. So while giving these solutions, we have to take caution regarding, like, we should not give or we should not administer these solutions with very high rate. We have to give very low rate, so that it will not cause that circulatory overload and pulmonary edema. Okay. So we have to administer with very low rate. Okay. And we have to avoid circulatory overload also. Okay. Second one is 10% dextrose solution. Okay, this one also considered as an hypertonic solution, 10% dextrose. So this dextrose will be used in the treatment of ketoacidosis. Okay? Dextrose will be used in the treatment of ketoacidosis. This one also going to be an one question. 10% dextrose will be used for the treatment of ketoacidosis. So again, this dextrose do not give with blood products. So while giving BT, we should not administer this 10% dextrose solution. Next, third category, third one is 50% dextrose in water. So this 50% dextrose we will administer in the cases of hypoglycemia. Okay. So this D 50% also we will give IV bolus. Okay. IV bolus. Here in 3% normal saline and 5% normal saline, we have to take care of that we should not administer in peripheral IV lines. We have to administer only in central lines or PICC lines. Okay. This should be one question. Okay. These hypertonic solutions should be administered in CVP line and PICC line only. Should not be administered in peripheral IV line. Okay. So these all are hypertonic solutions. That is 3% normal saline, 5% normal saline, 10% dextrose, 50% dextrose in water. Okay. These all are hypertonic solution. Here one chart is there. Detailed composition of IV fluids given here. We'll discuss already. We have already discussed this composition. In one chart, we will see all the composition of total IV fluids. Okay. You can take screenshot of these compositions of IV fluids. In normal plasma, the concentration of sodium is 135 to 145 milliequivalent per liter. Okay. These all values are in milliequivalent. These all values are in milliequivalent per liter. Okay. So the concentration of sodium is in normal plasma is 135 to 145 milliequivalent per liter. Chloride should be 100 to 110. Mostly 109 milliequivalent per liter. So potassium, normal concentration of potassium in our normal plasma is 3.5 to 5 milliequivalent per liter. Bicarbonate should be 22 to 26 milliequivalent per liter. Glucose is 4 to 7 gram per liter. Okay, 4 to 7 gram per liter. Okay. Now calcium is in 2.2 to 2.6 in normal plasma. The concentration of normal plasma is 280 to 295 milliosmol per liter. So this one again One exam question. The concentration of plasma, normal plasma is 280 to 295 milliosmol per liter. Okay. So we already learned in 0.9% normal saline, the concentration of sodium is 154 and the concentration of chloride is 154. Okay. So total osmolarity of the normal saline is 308 milliosmol per liter. Okay. Next, 5% dextrose. In that, 50 gram of glucose will be there in 5% dextrose. I already told that in 5% dextrose, 50 gram of glucose is there. That is 170 calories. Okay. The concentration of this solution, that osmolarity of this solution is 154. That is 5% dextrose solution having osmolarity of 154 milliosmol per liter. Next one is Hartmann solution. This Hartmann solution is also called as ringer lactate or physiological fluid. So in that solution, sodium concentration is 131 milliosmol per liter. How much? 131 milliosmol per liter. Chloride is 101 or 111, triple one it is there. Okay, potassium is 4 or 5. Bicarbonate is, that is lactate is 29. Okay, and calcium is 2. Values may differ, but it is of 270 milliosmol per liter. That is ringer lactate. Okay, 270. I told you that is 273. How much? 273 milliosmol per liter. This one gelofusine, it is at 154 sodium. That is the concentration of solution or osmolarity of solution. This sodium contains 154 milliosmol, chloride contains 120. So the total osmolarity of gelofusine is 274 milliosmol per liter. Okay, so these all are is in one chart, that composition of IV fluids. Here, so here we learned already, that is isotonic solution, hypotonic solution, hypertonic solution. These solutions are called as crystalloids. Now, major component of this IV fluids is of second one is colloid solution. First one crystalloid we already discussed in detail. Now second one is colloid solutions. So colloid solutions includes proteins. Colloid solutions includes proteins and large water insoluble molecules. So previously we learned that crystalloid solutions are water soluble solutions like sodium, chloride, potassium and all. Okay, here colloid solutions are proteins and large water insoluble molecules. In that proteins, albumin is there. Okay, albumin is colloid solution. So we will administer albumin in hospital settings. So that is an colloid solution. Starch is there, dextran is there, and complex polysaccharides are there. So these all are colloid solutions. Okay. So these colloid solutions remains in intravascular space for a longer time period. Okay. So these will remain in intravascular space. Okay. These albumin, starch, dextran, complex polysaccharides will be remain in intravascular space for a longer period of time. Okay, these two types of solutions we already learned. First one is crystalloid and second one is colloid. Okay. So what you learned already, this one we will practice by some questions. Okay. A patient come with an complaints of dehydration. Patient come with dehydration. Which IV fluid we have to administer for this patient? Okay. Which one we will give? I already told for dehydration which fluid we will give. First of all, we will give here. Here the category of solution is patient is of a dehydration case. Okay, so here we will give isotonic solution. We'll prefer isotonic solution for administration. In that, mostly 0.9% normal saline will administer for this patient, or 5% dextrose in water or ringer lactate. So these isotonic solutions will give in the case of dehydration. Okay, 0.9% normal saline, 5% dextrose in water, finger lactate. These solutions we will administer in the case of dehydration. Okay, this much is clear. Second question, a case of severe hyponatremia. A case of severe hyponatremia, which IV fluid we need to give for this patient. Okay, so I already told you, in case of hyponatremia, we will give hypertonic solution. Hypertonic solution. Hypertonic solution we will provide. But I told you already, while giving hypertonic solution, we have to be caution. We have to be caution for pulmonary edema and circulatory overload. So while giving hypertonic solutions, we have to take care of this pulmonary edema and circulatory overload. Okay, so we are already written pulmonary edema and circulatory overload. These conditions we have to closely monitor. Okay, while giving hypertonic solutions, we have to monitor closely for pulmonary edema and circulatory overload. Again, this one will be an exam question. Examiner will going to ask, while giving which type of solutions the risk of pulmonary edema or circulatory overload will be there. So we have to give answer, that is hypertonic solution. Okay, got it? Any questions will be there means you can put in comment box. We'll answer it in next session. Okay. Thank you so much for listening the session very carefully. If any doubt will be there means you can ask in comment section. Okay. I'm going to give answers in next session. Thank you so much.
Thank you for watching and subscribe the Agni Nursing Academy YouTube channel.